there are some courses, some lecturers will not tell you. They're just there. Like when you come for the exam, then you just see miracles, wonders usually occur.
Everyone, my name is Enejo Victoria Ojene. I'm in 400 level class.
For the strategies for preparing for tests, it depends on the mood or the pattern of the test. So it's very, very, very important for you to know the modality of the test before commencement of preparation. So I will talk about how to prepare for a test when you know the modality, and it test when you don't know the modality, because there are some courses, some lecturers will not tell you. They're just there. Like when you come for the exam, then you just see miracles, wonders usually occur in school. So for MCQ, when preparing for an MCQ test, I don't advise anyone to jot, because I don't think they'll, except there's a reason for maybe you always jot and all that. But for MCQ you need fine details. So the time for jotting, you can use it to read over and over again, because you really need to read over and over again, because you may know something, but because you don't know if it shifted to the right or shifted to the left, you'll fail that question. So fine details are required. You read for MCQs, you read in between the lines. If you're a person that uses highlighter, or you use maybe a different color of pen to make some things bold, that's the time you just sit down and try to highlight and try to make things bold and all that. And then for AC, that's when you can jot and all that, because there's something about the memory. A lot of people say they have picture memories and all, but I think that for everybody, when you will remember more when you see something, like when you have had a mental picture of something. So that's why once you imagine maybe a stuff in your head, you see that it stays more, because you have already had that mental picture. So that's what jotting does for you. When you write and then you keep seeing it, there are sometimes I'm writing a test and I see my handwriting, like I see what I've written before, because of how much I won't see the one I've written in red pen, how much I've seen it. So it's just to keep, like, it's just like a camera effect on it. So and then jotting helps you to organize your points. You know how to attempt every question, because you have seen that there is a pattern. Like, let me give an example. There was this test that we wrote recently, and then I saw that for every topic in that course, they follow a particular pattern. Once they move from this, for let's say introduction, they go to definition. From their definition, they are going to course etiology. From etiology, they are going to pathogenesis. From pathogenesis, they are going to clinical features. So when I'm reading another topic still in that course, I anticipate that once I'm finishing my etiology, the next thing that I should see in the slide is pathogenesis. I already know that, even when in the class and they're just teaching, and I didn't take note of the outline before, but because I've seen that they have a particular pattern, I'll see that the next thing, I will say, these people, the next thing that they want to write is treatment, and then of a truth, the next slide will be the slide for the treatment. So it helps, it makes you organized. That's one thing that jotting does for you, and that's for AC. So and then there's a new modality, best of 5. I would say for now, since we are not so used to it, for me, I still want to seek the knowledge from senior people that maybe have done it before or something. But I think MCQ can still suffice, because that one also requires reading in between the lines and then understanding. So for understanding, there's no how I can help you in that, but then reading in between the lines can help. Is a step towards best of. Okay, for your practical, let me just say, I don't know which class we're seeing this right now, but since I I just, the only professional exam I've written in medical school is second MBA. I think I'll have more knowledge on that. Maybe when I move ahead, I may know other things. So for your anatomy practical, I'll just advise that you make sure you are involved in the dissections and all. Don't just look around. I know, especially for medical students, dissection period is the time to gist and then to read other courses. I'm telling you because I actually did this also. Bring other notes to dissection hall and read them. But then, in as much, even if you are not following from the onset, just make sure that you do not lose any structure that they find out during that dissection. It should not be heard that in your table you did not know, you did not see it being found out. So I remember in my table there was this unusual rectus femoris. Like, the reason why I'm telling you that this is because it was so unusual. So the rectus femoris, when they found it out, it was not looking like rectus femoris at all. It was so slim, and then it had a tendon starting from almost mid, but we knew that was rectus femoris. So when we found it out, like, everybody had to come out, over other people in other tables, they had to come out like, wow, is this rectus femoris? So now in that case, when they're pinning that structure, first, nobody will have to tell you. You will not have to think that this is not looking like the normal muscle, even if the muscle that's supposed to be here is not looking like it. But because you were there, you were involved when the identification was going on, you will not really have problems. So just be involved. At the end of every dissection, make sure you can pinpoint structures that have been discovered in the this, because a day-to-day test, you may not really have that whole time. I don't even like maybe going around, like doing word round from one dissection table to another a day to test. I actually don't like that. So just some days, instead of not staying in my table, I just go around and say, what are people finding out? What are people finding out? Just moving around. It will be like a joke, but then you are learning. So for your physio practical, make sure you are involved. You get to understand what is happening. Don't just stay at the rear and then say other people do it. At the end, I'll copy practical report. I just be involved so that you know what is occurring there, what's happening. And then for BCH, also be involved. It's very it's so easy to be not involved, especially practical where you are quite a number. You'll be 11 in the practical group, and then maybe just 2 or 3 people are the ones at the forefront. So even if you are not there at the forefront, the thing that the people at the forefront are doing, please make sure that you are aware. You know what, as you're leaving that way, you know what they did. And then when coming to exams, for anatomy practical, you have to make sure you know your slides, your bones. Very important. I mentioned earlier that I don't like moving around a day to the to anatomy practical like test. The reason is that a day to, I like to settle down with my bones and know them, because you can go wrong in structures, but bone is something that does not move, something that they can color and then you can just identify. So you should not go wrong in that. But that's my take on that one. So in biology too, just make sure you know the slides and all that. And then for physio practical, they can just decide for us, we did steeplechase 150 spots. For some other sets, they may do live practicals, but anytime you do live practicals, usually practical with blood. So if you have been following and maybe you have something jotted down, you just go through it. Most of the practicals in physio, they're actually straightforward. They are straight to point. Just check PCV and all. Some of those practicals you can do it within 20 minutes. So the underlying statement is, please just be involved. That's why you came to school. If you are not a medical student, or if you are not a student, you'll most probably be at home, or most probably be doing maybe a business, working or something. So just put your mind into it. Then for biochem practical, it's very special in that you can go for a practical exam and know everything, and then you can also go for a practical exam and know nothing. So there are materials that you check, that you have to, let me use the word cram, for you to pass your biochem practical. So when it gets to it, when you are getting close to your MB, please make sure you seek the advice of your senior colleagues, people that have passed through, that there is nobody that passed by your care that did not check those materials. And then there used to be this tutorial that Jumsa usually organizes. It usually looks like a child's play, but please attend it. I think my freedom in biochem practical came from that tutorial. Like after I left that tutorial, I knew that I was not going to fail biochem. It was that impactful. So just for now, just be doing the practical and all that. But when you get close to the exam, please seek advice. Come for the tutorial. Not all tutorials, but I'm saying this particular one. That's then and people from clinics come and all that. You should just make sure you have to apply yourself and come. And then some things we explain to you, and also some of your classmates, and they may actually have a better grasp on that, on the practical stuff. So you can actually ask them. I'll give you an example. After that tutorial, I didn't really understand the calculation for vitamin C. So vitamin C determination. So after our anatomy practical exam on Friday, we're to have biochem on Monday. I just cornered one of my classmates, me and one of my friends. We went there with book and pen. That is either he teaches us vitamin C determination, or he must teach us or we die. And then he explained it for us, and then we got a full grasp. If I told you that when we came for that exam, the first question was on vitamin C determination, you will not believe it. But for that question, that particular question, it was past question. I already knew the answer before I started solving. So after solving, I said, okay, we have gotten here, let's move to the next question. So it can be that easy. That's why I told you that it's either you know it like very well or you don't know it at all. So those are the strategies. The practical is very, very important. That's why I'm putting a lot of emphasis on this. I'm taking a lot of time to explain for this practical. Very, very important. You can't afford to fail your practical. MCQ is not a place to get marks in exam. You can't get marks in tests. MCQ you can get 80 over. You can get I think there was a time one of my classmates, they got 96 over 100 in MCQ. Anatomy safe. So it's very, very possible. But in MCQ, you don't know where they're getting those questions from. Sometimes they may repeat past questions, but very unlikely. So it's not a place to get marks. Essay is close marking. So even if you write heaven and earth, you may not get what you should have gotten because the marking is closed. That's the system. But practical, there's no negative marking and there is no closed marking. So that's where you can get 40 over 40. And the thing about practical is that when you are finished, you can like say, oh, this practical, I've gotten 40 over 40, or I've gotten 80 over 80, or something like that. So please just take practical serious. But now, as if there's no exam in view, like I'm speaking to 200 level or 300 level initial, since there's no exam in view right now, just be involved in the practical you're doing right now. It gives you a leverage when exam comes, and then you have to learn a lot of things. You have an idea, and then when you have an idea, you can build on that. I've had my experiences, I have learned from my experiences, and I'm telling you that getting proper information is of importance than even having stuff. So I think I've gotten the point. It was a nice time talking to you all. I hope that you all succeed. Thank you.